Okay, good evening, everyone. Before we call the meeting to order of the DuPage County Health Department, let me get some of our legal requirements out of the way. Tonight, pursuant to Executive Order 2020-07, 2019 ILEO 20-07, issued March 16, 2020, during the duration of the COVID-19 gubernatorial disaster proclamation, the provisions of the Open Meeting Act 5 ILCS 120 requiring or relating to in-person attendance by members of a public body are suspended. Specifically, the conditions in 5 ILCS 120/7 limiting when remote participation is permitted are suspended. The DuPage County Health Department is the lead agency for DuPage County in response to the global pandemic, and as such is currently closed to the public except by appointment in adherence to public health guidelines and for the protection and safety of the public and staff. Tonight's meeting is being conducted remotely and is being live streamed for the public's viewing on the agency's YouTube channel, which can be accessed at the live stream link on the Health Department's website. Members of the public had the opportunity to submit written comments in advance of the meeting. The method for public participation is publicized on the Health Department's website. Public comments will be read and recorded in compliance with the Open Meetings Act. That being said, we will call the meeting to order of March 11th, 2021. And Penny, if you would call the roll, please.
Ms. Bottoms?
Here.
Ms. Finch?
Here.
Ms. Garcia?
Here.
Ms. Geider?
Here.
Dr. Hussein?
Here.
Dr. Munir?
Yes.
Dr. Skelton?
Here.
Mr. Spadoni?
Here.
President Tornatore?
Here.
Dr. Weeks?
Here.
Dr. Wilson?
Here.
Mr. President, you have a quorum.
Thank you, Penny. We now come to the point on the agenda known as public comment. People are permitted to comment publicly. They have submitted certain questions online, and I believe we have some tonight, Penny. Is that correct?
Yes, just a few.
Okay. If you would go ahead and read those.
Sure.
Please. Thank you.
The first public comment, VK, it's unbelievable that DuPage County health officials are preventing those with critical illnesses to get vaccinated. 87% of those who died in the county's own statistics had critical illnesses. Many places and countries are being fair to inoculate first doses, delaying the second dose, thus allowing more people to get their first dose. I wonder how many in this committee have not been vaccinated or have family members not vaccinated. Next comment, Bruce Walderson Wheaton. I just went to try to register for a COVID shot at the United Center, which is advertised as a mass vaccination center. I was surprised to see that they would not take eligible applicants outside of Cook County. So why are the COVID registrations being taken in DuPage County for people living in Cook County? Next comment, Joan Park, Naperville. I am an emergency physician for 20 years. I have treated patients with COVID-19 for 1 year now. That being said, we need our schools open full-time 5 days a week now. Our knowledge pertaining to this pandemic between March 2020 and March 2021 has significantly changed. The majority of people under the age 55 and of course school-age children have minimal risk for this disease. Schools have been open all over the country since August. We went to hear the plan and there has been literature coming out all the time emphasizing that in-person learning is what needs to happen now for a number of reasons for our kids. Schools are not super spreading environments. This has been written and stated over and over. With mitigation strategies, we don't need the 6-foot distancing rule that repeatedly is used as an excuse not to let kids back in. Please do what's right for our children. Thank you, Joan Park. Next comment, Jamie Jorstad, Naperville. I am a mom to a kinder and 6th grader and a junior in District 203. I strongly encourage you to help us get our kids back in full time. My children are already doing better since hybrid started. I can't imagine where they could go academically and emotionally if we could go back full time. I was able to get my vaccine through the county site and I have made it my mission to help all my kids' teachers get their vaccine since you guys are not making them a priority. Next comment, Jenny George, Naperville. Dear Board of Health, please update your guidance to conform to IDPH as soon as possible and remove any arbitrary metrics based on cases and positivity rate. If you want to continue to use metrics, they should be based on instances of severe disease that require hospitalization. You have put the burden of controlling community spread on our children, on our schools and our children while allowing every other business to open. We must get our schools open as soon as possible, and your guidance is keeping that from happening. Thank you, Jenny George. And that concludes the public comments.
Sam, you're muted.
Thank you, Penny, and thank you to all of you who publicly commented. Your impressions and ideas are important to us, and we are listening. Welcome, everyone, to the March meeting of the DuPage County Board of Health. Let me begin by introducing a new board member who I'm very pleased to say that has come on board, Paula Deacon Garcia. Paula was approved by the county board last Tuesday. I'm very happy that she is on board with us. She is from District 2, recently elected last November. I've had an opportunity to work with Paula and work with her in person over the last 4 or 5 weeks, and have found her to be not only very interested in public health, but certainly someone who I think will be an asset. Paula, welcome aboard. Would you like to say anything before we throw you right into the fire?
Thanks, Sam. Yeah, that's great. I'm very excited to be on here. It's such an honor to be working with all of you hardworking people who are dealing with health issues of all kinds. I'm excited to get going on this. I met with Lori Carnahan yesterday in regards to behavioral science, and so I'm looking at and I just want to meet with all of you. I know, Karen, when you're less busy, which is going to be like when, we don't know. I'm looking forward to the orientation, and I'm just looking forward to doing the work. So thank you for having me on this board. Welcome,
Paula. Thank you. Got a couple of things under President's remarks. Last month, we discussed the Joint Commission accreditation visit. This month, I'm happy to share that we received the Public Health Accreditation Board's 5-year re-accreditation decision. We were one of the first health departments in Illinois to receive accreditation. We're pleased to continue to see this high bar of excellence. Also, some good news. Oak Brook Terrace has joined the DuPage County Narcan program. They are the last municipality to join up. We now have 100% of DuPage County signed up with the Narcan program. I'm sure that makes Dr. Wilson very happy as the co-chair of the Hope Task Force, and makes all of us very happy that we once again in DuPage County are leaders on this, and now everybody's on the same page. As you might know, I have continued to support the health department's efforts, along with Chairman Cronin, to advocate to bring more vaccine to DuPage County. Karen's going to provide a comprehensive update shortly, and although there has been some progress at this point, it is and has been only incremental, but we believe that with persistence, we're hopefully getting our message across that we need more vaccine, and hopefully that will begin to come to fruition shortly. Also, I'm pleased to say that next month's meeting will have an in-person option. We got the go ahead from the boss, Karen, who said that, and Rashmi, who said that we could get together and do an in-person option for the meeting. We'll still have an option for remote, those who wish to do it remotely. We anticipate that we'll probably do it over at the Kurzweil Center, where we have our retreat, so we can socially distance. And I did promise everyone, Janice especially, that I would bring pizza the first time that we would be in person. I'm more than happy to do that, but we have to clear that with Karen, because she's got this thing about bringing food. So I'll have to work on her in the next month, Janice. But if we're allowed to do it, I'm bringing pizza that night for those who do appear. Another thing that I think is a good thing is a temporary reduction in the food establishment permit fees. As you know, in this past year, our restaurants have suffered significantly as a result of the pandemic. There's been a policy decision for a temporary one-time 50% reduction in all fiscal year 2021 annual food service establishment fees. I think that this is a message that we're sending our restaurateurs, that we understand how challenging these times have become. I also think it supports the actions of the county board, who agreed to increase the amount of the CARES funding for small businesses by 2.5 million to support local restaurants and bars as they've struggled to keep their businesses open. The good thing is this 50% reduction is virtually budget neutral for us. It will not have an impact on our bottom line. Approximately 40% of the food serviceman fees have been reassigned and are people into other COVID roles. They're being 100% reimbursed from grants from CARES Act funds. And I think it sends a signal to the community that we understand what they're doing. And as long as we're not hurting ourselves budget-wise, it's a good way to present what we do and how much we care about the restaurants, and hoping that they can get back on their feet over the course of the summer as we move forward. Tonight, we're also going to see a public comment bylaw amendment. We've talked about this in the past, particularly after we've had Paula. Luckily, you weren't here when we had 235 public comments one night, and we were here well into the night. It's going to mirror the public comment provision and policy of the county board, a 30-minute maximum, 3 minutes per person. However, if there's a particular point of interest or a hot button issue when we want to extend that beyond 30 minutes, we can do so on a motion by one of the members of the board and moving forward. Also, I want to thank Lisa Smith for not only helping us with that bylaw amendment, but with the the provider agreements that we have been working on. She has worked very, very hard in representing the health department from the state's attorney's office, as well as her job as the head of the civil division. She's been very, very busy along those in those ways. And lastly, I've been told to remind everybody that tonight, or Saturday night rather, marks the beginning of daylight saving time. So make sure you move your clocks forward. I'm not sure what that has to do with public health, but it's just a little something that we're going to let everybody know. That concludes my president's remarks. We're going to move on to public health updates. And Karen, I'm going to turn it over to you regarding an update on the vaccine distribution.
Sounds good. Thanks so much. And I think Chris is going to drive the slides. Just a quick note of clarification. I know one of the public comments referenced vaccines for educators. We have successfully worked with the ROE, and we have over 90% of educators, K-12 educators in the county have been vaccinated at this point, which although they represent, just one element of the frontline essential workers, they have been highly successful and prioritized realizing the need to get children back in school, as well as other parts of our economy and our community up. And Chris, I am seeing the presenter view. Great. So again, reminding us all that this is about protecting DuPage and building the safety for our residents and health. Let's move into the update for this evening. Okay, so here's the first question. Anybody recognize the guy on the left or the name of the business? Or even what he's standing in front of?
The refrigerator.
Well, that's very close, Dr. Weeks, and you get a gold star for jumping in. It is an ultra cold freezer that's made by Thermo Fisher. And the gentleman there, his name is Jim Nani. And I'm going to be talking a lot about numbers tonight, and as we always do in our public health updates. But I think this is a fascinating story. So Jim Nani is the owner of Temprite, and Temprite makes the oil separators that are vital components used to create these ultra low temperature freezers. Because as he explained to me just very briefly, If the oil gets around, I don't know, I can't even tell you what he told me anymore, but it is one component that creates the opportunity to get to that minus 92 degree temperature range. They are one of the very few manufacturers around the world that produce the part. It's a separator, it's like a filter to keep the oil out. And they are located in West Chicago. Previously, they had made in their plant with about 45 employees, they had made 50,000 units a year. And in this past year, they have produced over 250,000 or 250,000 pieces. And I had the opportunity to talk with him, get he and his staff registered. Andrea and Bill Lindholm, our facilities manager, gave him a tour, gave us some no-cost tips on keeping the units operating fully. But really another, I think, really stellar example of how DuPage County's influence is really a global influence when we're talking about the pandemic response. So where are we at in terms of vaccinating people? And now we'll get into the world of numbers. As of today, nearly 100,000, 98,224 residents are fully vaccinated. Next slide, please. If you remember what our goal is the 80% of the over 18 population, at least until there's a vaccine that's available for the pediatric population. So about a third of those folks have received at least one dose. And again, 98,224 are fully vaccinated. This week, our allocation is 15,330 doses. We have administered, since the start of March, we've administered about 80,000 or 78,000 doses. And that represents the 98,000 people who are fully immunized with the 2 doses, represents almost 11% of our total population. We've been able to bring that up by almost 4% since the start of March. On the right-hand side, those are the daily doses administered to DuPage County residents. And you will see that we are on a trend upward, but it is very definitely influenced by vaccine availability. So what we see, we have been leading the collar counties. And if you consider Kendall as one of the collar counties, then we've actually slipped to number 2. Otherwise, we're still on top with the number of people who are fully vaccinated. You will also see that our 7-day rolling average, our daily shot count going into DuPage County residents has risen to over 8,500 per day. So we continue to be not only at a good place now, but we're also building capacity and increasing the number of people who are getting vaccinated. And that is in spite of the fact of our vaccine allocation. A little bit more about who's getting vaccinated. These are stats, and this is as of yesterday. We see that, and this is from the state, right? So according to the state, we have about, a large percentage of the race and ethnicity, a large percentage of our doses are going to white residents, but then there are mixes, and it's a little hard to read, and they don't include percentages, which makes it a little bit of a challenge. Going to our populations of color throughout the community, you'll also see that they reflect that we have about 120,000 individuals, 121,000 almost, over the age of 65 who have been vaccinated. Our numbers are a little bit different. We estimate that the over 65 population actually represents about 17% of our total population, which is around 155,000 individuals. According to our data, 41,658 of those 65 and over are fully vaccinated. That's about 26.9% of the 65 and over who are fully vaccinated. Now, 83,888 have received at least one dose. So that's about half of that total population. So again, remember, teachers, we've gotten over 90%. Seniors were climbing over 55 or 54% have received one dose. 26.9% have received two doses. So we continue to make pretty good strides in that 1B population. We still see the gender disparity, and I think that more than vaccine hesitancy amongst males, that reflects simply the populations who were vaccinating. So 1A was the healthcare workforce, which tends to be much more female dominated. And then we have long-term care facilities, also have a higher representation of females. And now now we're seeing that instead of 67%, it's down to about 60% of those who are vaccinated are females. So we anticipate that will continue to move closer to a 50-50 representation. This represents, and this is a new feature on our website that we've added under the dashboard of disease. You can find information about where vaccine has been distributed. We have distributed a total of 65,715 first dose Pfizer vaccines and 68,500 doses of Moderna. And so you can see across the bottom there, the different weeks. You see that there's wide variety. The blue is Pfizer, the orange is Moderna. So there's great swings and great variability in what vaccine is available to us. We have not yet received, nor do we have in our 3-week look ahead, any allocation of the newly approved Johnson & Johnson vaccine. This is a week-by-week characterization of our, or representation of our vaccine that we are being allocated by the state of Illinois. You will see that week 9 represented the all-time low of 2,450 doses that we received for the week for our entire county. We since have been trending up. We have We anticipate 2 more weeks in around the 15,000 per week dose. However, then again, we're stepping off a cliff and our allocation is going, at least based on our look ahead at this point, our allocation is going back down to around 5,800 doses for the week of March 29th. So we continue to see these wild variations, and just when we think or hope or pray that we're on a trend, in an increasing trend, then the bottom falls out. So we are still very much working to understand why that's happening, because it appears based on CDC allocation to states that the allocations to the state of Illinois is remaining fairly constant. So, and even going up slightly on a week-to-week basis. So we have not yet received clarifying information on that, but we continue to ask. We have spent the last however many weeks now, it probably 16 weeks intensively and months prior to that, identifying our internal capacity, and by internal I mean within DuPage County, not within the health department alone, how we could vaccinate our residents effectively, quickly, and equitably. So we have developed this graphic because as a tool of alerting and educating both our policymakers at the state level as well as our partners in public health of what our needs are in DuPage. So you will see that we have currently, like tomorrow, we could begin putting 65,700 doses in people's arms. And that's a combination of our 8 locations that we consider to be mass vaccination sites. Those are sites that are stood up every day. A couple of these are 7 days a week. These are large health systems who have invested significant resources in hiring staff on, in securing locations, in equipping those locations with necessary supplies. And we could do, between those 8 sites, we could do 40,000 doses per week, just there. Now, contrast that with the 15,000 doses that we're getting. Contrast that with the 5,800 doses that we anticipate getting in a couple of weeks, and you quickly see the challenge that we're facing. But on top of that, we built into our vaccination plan to have 1 or 2 day events over the course of the week at community sites. And with these sites, we would target specific community organizations. And it's one of the strategies that we're looking forward to receiving our medical van next month to be able to take the vaccine into the community and at the same time maintain the integrity and handle that vaccine appropriately. We also have partnered and been working intensively with our FQHCs. Those are federally qualified healthcare centers. Those are healthcare centers who agree to serve individuals in their catchment areas regardless of ability or inability to pay, regardless of citizenship or residency. And so we have estimated that each of those 8 locations could provide about 100 doses to their patients a week. and move us forward by 800 doses. Then our pharmacies, our retail pharmacies would, we have about 115 locations throughout the county. Each of those have estimated that they could provide 1,000 in-store vaccines. So that adds another 11,500 doses a week. And then finally, through primary care and other medical providers, we estimate 3,400 doses. So we are quite confident that we have vaccine administration capacity to, and this is without pushing too hard. You know, any system, you have capacity, and then once you get things rolling, you find ways of increasing that capacity. We're very confident that this 65,700 could be achieved if we could simply get the doses of vaccine allocated to us. We also have started providing on our website a representation. So we have the responsibility and challenge to take that 15,000 doses, or, you know, that 1 week, those 2,400 doses, and then decide who in our county should receive that. And so this is a breakdown, not of the specific organization, but the type of organization. And you will see that hospitals for this current week, or week 12, have received the majority. But we also have medical practices, our FQHCs, physician groups, the health department, and we work to make sure that there is broad access to when we allocate the vaccine across the county, regardless of how much it is. So how do we know we have enough capacity? And this is a question that we've been contemplating since the start, because we continue to hear both IDPH leaders as well as the governor speak of the time that vaccine will be very, very plentiful. And so what does that mean? How can we quantify that? And how do we know if we have enough capacity or if to provide the vaccination, or if we need more? So right now, the state is looking at the max capacity, and we've heard this a number of times now. So we're beginning to think that this might be the max capacity, at least for the near future, of 100,000 doses a day for the state of Illinois. So if that is the Illinois estimate, that would equal about 700,000 doses per week, or 2.8 million doses per month. So if we take the estimate of DuPage being representing about 7% of the population, you see that from a weekly perspective, if we got a full 7% of the state's allocation, we would need to be able to provide 49,000 doses per week. And again, we have the capacity to provide 65,000 doses per week. So we feel comfortable with where we're at, as comfortable as you can be, kind of operating with the lack of forecasting that we're receiving. But we feel very solid in the numbers and the estimates that we have developed through partnerships. Now, where do we target the vaccine when it does come? And again, you'll remember that we use the CDC's Social Vulnerability Index So these are the darker the shaded areas represents the higher the ranking. The social vulnerability index is kind of a composite index. It tracks on 15 different social factors, including unemployment, minority status, income, disability, and then groups the communities into 4 related themes. So you'll see the areas. I don't think anybody's surprised with the areas that are shaded in DuPage County. But again, this is the picture that represents the challenges in a densely populated suburban county that are different than urban areas or rural areas. We have pockets in all 4 corners of our county and in between. And so you can't simply say, well, if we just get the north side, or if we just get these 2 communities, then we have the vast majority of the underserved populations. We must have a much broader strategy to address this. Again, on a weekly basis, we calculate. We feel very compelled to use some sort of model and a consistently applied model to be making these decisions on our vaccine allocation decisions. And so these are the considerations that we apply. And so as we move from, the actual vaccination and back up the process a little bit, this last month, we actually went through a registration system upgrade, and some of you may have gotten some upset calls or concerns about the decision to upgrade our registration system. But we felt it was very, very important, particularly with this continued trickling in of vaccine, to make sure that we were targeting the vaccine to the appropriate places. So you remember that we had over 259,000 people on our registration list. Those are people who had signed up on our website. We provided them with an email saying that we were making this change and asking people to re-register. Out of that, we had 107,506 individuals who re-registered. We also asked people to tell us if they had already received vaccination and wanted to be removed from that list. And so we were able to take 10,231 people off our list. Individuals who do not respond won't be transferred to the new system. So we have been working to make sure that people who were on the list are appropriately categorized. And that's the breakdown that you see of the people who re-registered. We now can very easily quantify how many 1As do we still have on our list? How many 1Bs are we still waiting to get through? As we anticipate moving into the 1B plus category, how many people do we see there? We just had an opportunity to work with one of our private pharmacies who wants to do a clinic for preschools, daycare, childcare workers. We were able to very quickly identify that we had the number of those individuals who we had registered. So this allows us to be much more strategic as we're planning events and working to get people across our community vaccinated. So that's one of the other things that we have been working on as it relates to COVID this past month. We also have continued to provide the ongoing technical assistance. So we continue to meet with the Regional Office of Education and school superintendents. Quick note of clarification on that. CDC just released updated school guidance at the end of February. Regardless of the fact that we have gotten a lot of comment from our residents and interested people, and I fully understand that people are very interested in getting kids back in school. That's where kids need to be. But CDC only just updated their guidance in February. And so we have been working with school superintendents and the regional office on those updates. We've also continued to work with mayors and managers. And in fact, they're going to be recording some PSAs for us and assuring their residents that we're getting to them as quickly as we possibly can, and to be patient and to assure them that everyone who wants a vaccine will get a vaccine. We also continue our work with police, fire, and EMS. We have our weekly calls with hospitals and healthcare systems. And we also continue to work kind of on an ad hoc basis with the judicial system, our judicial system partners. We continue to have our ongoing technical assistance provided through our COVID business team and our COVID education team. Those staff, although they're returning to their previously assigned responsibilities, continue to field thousands of calls and inquiries on a daily basis. So you'll see that our business team has fielded over 14,000 individual contacts, and our school or education team is creeping up there with over 10,000 contacts. The other group that I wanted to just highlight very quickly for you is our HEART Coalition, our Health, Equity, Access, Response Team Coalition. We co-lead that with the DuPage Federation on Human Services Reform and the DuPage Health Coalition. The membership represents ethnic and diverse racial groups, ethnic groups, and even religious groups that have been disproportionately affected by COVID. We have been working with them to identify resources to provide mobile vaccine clinics. These typically aren't large, but they are hyper local focused. So we provided linkage to the Lyle AME Church, to ICNA, which now I can't remember what that stands for. Rashmi?
It's Islamic Coalition, maybe. I can't, I don't recall, sorry.
That's okay, that's okay. The Hindu temple, some additional AME, Black African American churches, and then to township seniors. We also have used this group to help us better understand if there the level of vaccine confidence, and on the flip side, vaccine hesitancy, where people get information. That survey will close on this Sunday, but the next slide breaks down some of the key areas. So we have gotten 3,000 so far, 3,000 English respondents, over 600 Spanish respondents. Some of the key takeaways are and messages that people want more information about is, the English speakers, over half of them want to know if the vaccine will protect against new strains of the virus. And about 76% of the people who responded reported being comfortable receiving the vaccine. Another factor that I know I've heard Kara Murphy talk about is that the difference in where people get information about the vaccine from. And the English-speaking respondents tend to get that information from their healthcare providers, whereas the Spanish-speaking respondents get that from family members. And so we know that if we want to increase the percentages of those populations who may be a little bit hesitant, then we have to get spokespeople and make sure that family members share that information amongst each other. So in our Spanish respondents, 2 of 3 have concerned about the side effects of COVID-19. However, a higher percentage report being comfortable with receiving the vaccine. So we're not seeing a lot of vaccine hesitancy, but there are concerns, and we need to get information about the side effects of the disease out there. Also, we have added, particularly as we expanded into the 1B population, which includes populations that may not be as literate in online platforms and others. We have expanded access through an external call center. We implemented and contracted with this external call center because we were having significant increases in the number of calls that was impacting all of our operations and wait times. But we also wanted to provide support to answer calls specifically to vaccine questions. This allows our internal call center staff to continue to operate and focus on our internal operations, whereas we partner with call experts, is the name of the business who we contracted with, and we provide the scripting to their call center staff to ensure consistent messaging. In a little over a month, they have fielded nearly 12,000 calls through that call center. So they are extraordinarily busy, and we are very, very grateful. We continue to work our case investigation and contact tracing efforts. We have 230 of the specialists who are working in that program. We have phenomenal outcomes. So we have been able to initiate contact with 95% of cases. So these are people who are, we receive a positive test result. We are able to initiate contact with 95% of them within 24 hours of that test result. That's critically important because many of these people don't have symptoms. So without that kind of intervention, they would continue to operate business as usual. And we're also able to get to even more people if you extend that time to 48 hours. We saw that early in this pandemic, that was the challenge. Oftentimes it was 10 days or 2 weeks between the time a person was tested and when they were given their test results and provided with the education that they needed to eliminate exposure. So we find this as being highly successful in reducing the spread of virus in our community. We are the leading health department in our overall volume of contact tracing outreach. Now we have a grant to provide this level of support through the Department of Public Health. We will have expended that grant by the end of March, which is later this month. And so we have requested an additional amount of money for these services to continue through 2021 through the Illinois Department of Public Health. if those efforts are not fruitful to acquire those dollars, or if potentially we can only get part of those dollars, then additional funding support will be coordinated through the county with some of our unspent CARES dollars. We will continue to leverage our legislative advocacy channels. And we may have to shift over to a more or at least a hybrid staff volunteer program to support. Our plan is to, if at all possible, it's a little bit unclear when the Illinois Department of Public Health would provide us with a up or down on whether or not we will get additional funding for our efforts. But our goal will be to have an answer from them by the end of March, and then in April provide you all with the recommended course of action for the remainder of 2021. From an internal operational perspective, we are back into what we call our phase 2. And that means that 85 to 100% of our clinical services are being provided on-site at our location or on-site in the community. We have our business support services, which are still in a hybrid type of arrangement. Many of our business support services are able to operate remotely. And so we've been really working to make sure that we continue to abide by the 50 people or 50% of the workforce at any one time. We have a very small percentage of individuals who are continue to remote work whenever possible. As we're bringing staff back, of course, we're making sure that we abide by all of the safety guidelines, protocols, and infection control recommendations in order to keep our staff and our clients safe and healthy. So I'd like to open it up to questions, and I think Dr. Chu, you dropped in the chat that it is the Islamic Circle of North America. ICNA is actually one of our heart partners and one of the groups that we were able to reach out and provide some support with vaccination over this last month. Thank you.
Thank you, Karen. Does anyone on the board have any questions of Karen's presentation? I'm sorry, raise your hand again. Is it Paula? Did I see your hand? Yeah.
Yeah, as the new person here on this board, I'm just wondering, I mean, I know myself personally, and I think all county board members are getting questions all the time about the supply. We're forwarding them to you, you're great at getting back to them. What I'm trying to figure out is why we aren't getting the supply. And I don't know, I know you said you can't figure it out either. Is there people we should be contacting and the county board, or how should we be figuring out why we're not getting our 7% share coming to DuPage County?
Yeah, so we would recommend reaching out to our state legislators, anticipating that perhaps they might be able to advocate on our behalf with the Illinois Department of Public Health and the governor's office. It is, and we're also reaching out to our, federal congressional delegation. We have one of the challenges that we contemplated was, we were told that we had too much inventory, unused inventory sitting in DuPage County. And so we had several conversations, discussions, meetings with IDPH to say, so are you saying we should push out all of the doses we have, whether they're first or second doses? Will that help us get more? And we were told absolutely not. Second doses are meant to be second doses. Just make sure you're getting first doses out. So we continue to work with our providers, our vaccine providers. We have, a couple that are coming along, needing a little bit more attention and motivation to get vaccine out quicker. But we were also told by IDPH that the fact that we had a big supply of, or what they considered a big supply of doses on hand, had not been a concern. And so we're left to kind of just shrug and not really understand it. When we see these swings in the third week, the week 3 look ahead, the first thing I did was checked with my counterparts in Cook, Lake, Winnebago, and they said they're seeing the same thing. They're seeing the same pattern with their distribution. So clearly it's something that's happening at the state level. But again, we don't know why or what. I also remember Chris Hoff in one of our conversations said, that 2450 week represented a 75% reduction. Should we be anticipating something like that again? And the answer from IDPH at that point was, oh, absolutely not. And yet today we're faced with a very similar kind of situation. So I'm not sure how best to advocate. And I know, Sam, you've been involved in many of those conversations. I don't know if you have thoughts, or Chris Rushme, anybody else on the leadership team.
Well, my thoughts to answer your question, Paula, is talk to anyone you can, anyone who'll listen, who you think might have some influence with IDPH and or the governor's office, as Chris and Rashmi and Adam and Karen and everybody else, including the chairman, will tell you it's very frustrating to get a non-answer when we're on those conference calls, and to see the swings, because not only does it mean that we're not vaccinating the adequate number of people in our county, but we don't have an answer for our people who ask these questions. And
right, I think people, that's the most frustrating.
Yeah, I mean, we're frustrated by saying we don't know, and we don't. And you've heard me say that a number of times at the county board, and I think people are now starting to get it, that we really don't know. I've had a couple of calls today, actually, from county board members asking the same question: who do we call? And if you've got a relationship with a congressional person or a state person, I would say reach out to them. I know that Chairman Cronin continues to advocate with Karen. We had a call yesterday that we were on, and I don't know if you want to share it, Karen, but you don't have to if you don't want to, but it was bordered on the absurd. Is about all I can say about what was recommended or offered to us, given what we need. So
it all comes from the IDPH, correct?
IDPH / governor's office, I think, would be probably the better way to characterize it. It's, some of it's political, from the political arm of the government. The governor's office and others is through the through IDPH, but we've been given a lot of non-answer answers, and we've certainly heard more within the last few days regarding the United Center and opening up originally for all citizens of Illinois, and then for a reason that they have determined to be equity purposes. I understand that only 40% of the people who were registered at the United Center were from the city. Therefore, they decided to close off registration to anyone outside the city. And now I understood from Karen earlier today that they've even taken that and reduced it to 4 zip codes within the city. So there are people within the city who aren't able to go to the United Center, which has caused many of our residents to say, if you can't get a vaccine at the United Center if you don't live in Chicago, then why are we offering vaccines to people in DuPage County who don't live here, even though they may work here?
Right.
And it's a good question. It's a question that, we might have to examine somewhere down the road. But certainly our position has always been, Karen, correct me, and Chris, we've offered it to people who have lived or worked in DuPage County. And that made some sense to us, providing that we were going to get the appropriate number of vaccines. But we seem to be getting squeezed out. And I also think that the more vaccines that are going to a max vaccination site like the United Center mean that there's less to go around for the rest of the state, including DuPage County. And if those vaccines aren't available to everybody else, then once again, as I think I mentioned to somebody on one of the calls, as the categories keep expanding, 1A, 1B, 1B plus, the governor keeps inviting more people to the pool party while he's draining the pool of water. And I don't know how we deal with that and how we respond to that to our citizens who need it, who want it, and who deserve it because they are from various groups. We are a diverse county, and the way, as Karen has indicated, we just don't give it to one particular area. We spread it around, and we spread it around based on metrics that are developed to deal with disproportionately affected areas and disproportionately affected groups as well as others. So we're trying to be as equitable as possible, maybe unlike some other areas. So I don't know, Karen, you guys want to add anything, or Dr.?
Try to contact some state legislators and see if I can get someone to work with IDP.
Yeah, that would be great.
Yeah, the other consideration, and we have typically not done it, but what might to consider is perhaps either a letter from the DuPage County Board of Health or a letter from the DuPage County Board together with the County Board of Health raising these concerns.
Okay.
So that may be
that.
something.
Okay.
And,
I
and
will.
to that, I have spoken, I did speak with a couple of county board members today who are feeling the same frustration. And I think at some point we're going to have to take this up and see if a letter from the county board to the governor might do something. I think Dan Cronin's ready to pull his hair out because he's been advocating like a madman for us, and continues to feel the same frustration that Karen and I and the rest of them. And it's not, we all get it, but the information that we've heard on some of these calls is quite frankly just flat out wrong. We got a spreadsheet a couple of weeks ago after we questioned the number of vaccines that were coming to DuPage County that indicated that there were 35 or 40,000 vaccines that went to DuPage County, and it turned out that about 2/3 of those were going to counties other than DuPage. They said, well, what about that one hospital? What's the name of the hospital, Karen, that went in Kane County that they thought was in DuPage? You're on mute, Karen.
Rush Copley.
Yeah,
Yes.
Rush Copley.
Mhm.
Well, you got, Rush Copley, you got 12,000 vaccines. No, it's not in DuPage. And then another group in Burr Ridge that got 12,800. Well, what about those? Well, that was in Cook. And their answer was, oh, we must have bad intel. We better go back to the drawing board and figure out what's going on. Those are the answers. Those are the people that we're dealing with. So
That's frustrating to hear.
it's
I will say our local representatives here, Karina Villa and Mara Hirschner, specifically were successful in procuring federal doses through Jewel Osco for the essential workers at my company. And so it seems that even our state and local representation is going around the state. And somehow I don't understand where federal doses are versus state doses. I don't understand that at all. I thought everything was going through the state, but apparently not.
Well, welcome to the club. None of us do.
Mhm.
And that's the other frustration, because as I was explained to me early on, the feds were supposed to give it to the states were supposed to allocate it to local health departments. We're supposed to look to allocate it to our partners. And that was the way it was set up. And then suddenly we had Jewel Osco's and other entities who began to get vaccine allocations independent of the DuPage County Health Department. And then those allocations were given to specific companies, specific school districts, specific municipalities, all of which are great. And the more people who get shots in the arms, the better. But they're only going to selected groups of people and not through the entire county. And that kind of defeats the purpose of what we've been trying to do over the last 8 or 9 weeks. So
if I might say something, my understanding of why the state went around, and possibly even the federal government, because there are real issues of equity, and that has to be addressed. But Karen, if I might ask, what is the expectation of IDPH at the end of a week after vaccines have been allocated to DuPage County?
In terms of,
I'm trying to figure out why they believe or think that we're not using the vaccines as we should. I mean, so what is their expectation?
Yeah, the expectation is that anybody who receives vaccine uses those first doses within 7 to 10 days. And we have, through our ongoing efforts with our weekly calls with our healthcare and hospital systems, and then we have a couple of staff who we refer to as vaccine coordinators, on a daily basis with the providers receiving vaccine to assure that they're moving the vaccine through their clinics. Now, it has been only the last week that we've had access to actually look in the same systems that the state has been looking into to see, are the numbers that our vaccine partners providing us consistent with what they've recorded in these systems? And the vast majority, 90% of them, that is accurate. What they tell us and what we can see in the system is accurate. We have a couple of providers who are working on to get their throughput up a little bit. But again, that is not, it is not the majority of the vaccine. The majority of the vaccine that we have in the inventory continues to be those second doses, and the state of Illinois has no way of being able to determine which are first and second doses. We can, because of the way we order and have structured our data systems to monitor that. So we've been doing that since the first, 3 weeks in, when we got our first second dose shipment. But the state has no way of knowing what's first and second doses that are on the shelf. So
okay, so how do we bring them on board to understand how we are controlling the inventory?
I am very open to ideas. We have graphs, we have charts, we have talked. So we have on 4 separate occasions talked to the state of Illinois when these issues first came up, and they told us that they didn't think we knew what we were doing. Not quite in those terms, but pretty close. And we have articulated that over and over, that we do not have a vaccine administration resource constraint, we have a vaccine resource constraint. And yet, the call that Sam is talking about that happened yesterday, they're offering us Illinois National Guard troops to administer a vaccine. So our first question is, well, great. Does that mean we'll get more doses? And the answer is no.
Yeah.
Well, we
This
don't
is this.
need
Yeah.
more
This is what they.
administrators. Yeah. Mhm.
No, I mean, I'm glad Karen's sharing this because they offered us yesterday National Guard troops without any more vaccines. And when we explained to them what our capability was and that those National Guard troops could certainly be put to better use in other areas of the state than here, it was met with silence. I'm not sure what their response was, and they couldn't commit any more vaccines. And I don't know if that was an offer so that they could put some National Guard troops out and somebody could come out here for a photo op, which is what I understood took place in Grundy County today. There was a new mass vaccination site open in Grundy County, and was on the news. But we don't need one. We've actually done it better. Instead of one area that has everybody coming to one or two particular locations, you can go to well over 100, including some mass vaccination sites. And to the extent of equity, yeah, I'm all for that. I think if you looked at the slides that Chris showed and put up and Karen commented, the whole point of the way our distribution is set up is equitable, based on a variety of ways.
I did look at the slides, and at the bottom of the slide, we saw the least amount or percentage of vaccines were going, I believe Latinx people were at the bottom, Indigenous Americans, African Americans, and I can't remember the others. So that tells me there is an equity issue. And again, from my understanding, that's why the state brought in a set of vaccine clinics, and I didn't know the federal government was going around, but maybe that's why they are too. But it sounds to me like there's a communication issue, and I'm not suggesting that you don't know how to communicate, Karen, but it just sounds to me there's a breakdown in the communication. And I hope I'm not that naive to believe that it's more a breakdown in communication than politics, because I'm not a politician. But I'm going to reach out to someone I know. I'm not going to say who it is. And if I can, I will, with your permission, I will ask them to call you and maybe set up some kind of meeting so we can deal with the communication gap. Is that okay?
I would welcome any opportunity.
Okay, thank you.
Mm-hmm. Yeah, I in any other situation, frankly, I would have given up, but this is life and death for people in our community. This is being able to stay on the job. This is, providing for your family. These are situations that require, I think, an extra level of persistence. And I agree, for whatever reason, what we're saying is not being heard. And I don't know why that is. And if there's some other way that we can communicate, I am willing to say it in Spanish or Pig Latin or any other way that I could to get it across. We've tried pictures, we've tried all kinds of things. But again, absolutely, I would be happy to. I just want to reflect quickly back on the slide on race and ethnicity, though. Because fewer residents who are people of color have received the vaccine, I don't think automatically implies that we have equity issues, because I think, and unfortunately, we can't access the same information that IDPH does. But Dr. Chu, I think our African American Black population is 5% of DuPage County. Is that right?
Yeah, so around
right.
4.6 or close to 5%, I believe. Right.
Right. So I don't know if that sliver of the whole so there's no way we're going to get more than, if we vaccinated everybody in DuPage County, right? We'll still have only 4.5% who are African American, because that's all we can vaccinate.
Right, that was my point. I'm glad you did that, Karen. And Janice, I'm happy to discuss that with you over a slice of pizza anytime, because I think that those numbers are again a little bit misleading. Karen, if I could Chris, can you go back to the slide that talked about the updated registration system? Because I had a question regarding that. No, not that one. Keep going. Going. Right. Okay. Now, 259,000 original emails, and now we have 107,000 people who have re-registered because of this updated system. 10,000 indicating that they were previously vaccinated. So if I do the math, that's about 118,000 people who indicated they're previously vaccinated or re-registered. 118 out of 259. That leaves about 140,000 people who apparently were originally notified but aren't now in the system. Does that mean they're out in limbo someplace?
So I'm going to ask,
because they haven't accessed or re-registered under the new system?
So I'm going to ask Adam to jump in, because he's overseeing this and has all of the answers.
Okay.
Yep. Yeah, that's basically correct, Sam. There's a lot of people that have not completed the re-registration yet. The good news is all 259,000 people that were in the original system, they have migrated over to our new system. So they're there. We haven't lost them. We have their information. They just they're not being integrated as part of the new Active Directory that we will proactively communicate with until we get that additional information from them in re-registering.
So does that mean they've lost their place in line, so to speak?
No, it does not mean that. So one piece of information that we were able to migrate with them is the day that they signed up. So we still know who they are and where they are. And when they provide that additional information, we can match that back up and say, okay, we've got all your additional information and we know that you signed up in January. We got you.
Okay, that's good, because I was concerned about where those people were in the system and whether or not they somehow got lost in the re-registration issue.
Yeah, and if you have people who are not computer literate, or they're not sure what they're doing, just simply have them call the health department, and we will have people do the registration for them.
Yeah, as much as you guys, because I know this has been a major upgrade for us that does a lot of things for us that, we have better intelligence on who's still seeking vaccine in the community with this. We have better ability to have more precision in our targeted messaging to schedule people, and we're able to better prevent a lot of the line jumping type behavior that I'm sure you guys have heard about. But I know this also is probably created some concern for folks. And so to Karen's point, I can't stress that enough. If they are worried about their registration status, just give us a call. Our call center is ready to walk them through it and make sure that they are updated in our system.
Well, I guess my answer to that, or question to that, is how would they know? And how would they know if they should be concerned about their registration status if they don't know about their system upgrade? Because they're not computer literate.
Yep, another good question. So We sent out the email to all 259,000 last week. We sent another email to anybody, the gap that you identified. All of those folks got another email today to remind them. And we are working with a couple different, with senior services at the county, with a community group and some others to really make sure to get the word out that is the case. So, I mean, we've put it in press release, social media. We do really want to try to get the word out. If anybody is not seeing that email, that somebody else is letting them know, just call the health department if you have any questions. So we're really trying to do that. And we're not going to give up on that. We just talked to the team that helped us put the system together this afternoon. And I said, I really want to keep tracking all these people that could have otherwise been lost and make sure that we're keeping tabs on them and keeping the door open for them.
Okay, so as long as people aren't losing their place in line because they haven't re-registered.
You got it.
That's my concern. Okay.
And Adam, can I just add too that the new system keeps track if people have started their registration and just haven't completed it. So we also have people that are in limbo that we know that they've opened it and started to re-register, but haven't completed that full registration as well. So there's some people that are, in the process of getting all the way over.
Okay.
This is Lanny Wilson. 2 questions. Would some of the change be that people signed up and got their vaccines somewhere else? Is that a possibility for the change in numbers?
Absolutely. And we have 10,000 people who said they did, but if I did and I don't feel like I want or need to tell us that they did, there's nothing to compel them to as well. So I think those are the rule followers that are represented with those 10,000 people.
And if I can raise my hand, I'll say that I'm one of the people. I signed up my parents and on the health department website, and I got those emails and I ignored them, and my parents already got theirs through their health care. So I think I might be a representation of the overlooked, response.
Yes.
Parents got it. And I was like, oh, okay, ignore. So
Yep.
I will not be back in there.
That's right.
Good to know.
Okay, any other questions of Karen on the presentation?
Actually, Karen, I have a really quick question. Totally not vaccine. So, so just the other big elephant in the room. Do you know when you guys are going to spend some time to update the school guidance that you're giving out to the district schools? Because I know I'm very familiar with 204 because that's where my kids go, and we were getting emails saying they're talking about going 5 days a week, and I think they really, really want that guidance from you guys to just, it gives them that sense of security, which they've been following all along. So just having that would be nice. And just wondering when you guys are considering updating that. I know it just came out, the 3-foot rule, but add it to the list, I guess.
No, we've been following that, and we have just updated guidance and IDPH. So, CDC releases the guidance, and then IDPH weighs in, and then IDPH works with ISB to weigh in on these school situations. And then at the same time, we're working alongside that. So we have updated guidance based on that CDC, and are much more in a consultative role with the schools, indicating that, this is a public health kind of guidance, but really making sure that schools have the tools necessary to both assess their mitigation strategies, as well as making the decisions that they need to make based on all assorted factors that superintendents look at. So we are putting that squarely back where the authority lies, with them, because that's another one of those, although it's not talking about vaccine, it really is a no-win situation, right? And so what we want more than anything is if they have whatever decisions that they make them as safely and that they protect the health of the students and staff to the utmost. So we have actually an IDPH webinar tomorrow afternoon that we'll be doing, and then any further updates that are needed will be made at that point. And Dr. Chug, I don't know if you have anything more to add.
That pretty much covers it, as you mentioned that. So IDPH, their new guidance does incorporate aspects of the CDC guidance, but then also draws heavily from the American Academy of Pediatrics and the World Health Organization. And so, as you mentioned, they are promoting the 3 to 6 foot physical distancing with strict adherence to masking. And there have also been studies recently showing suboptimal masking in school settings. So I think that's where as Karen mentioned, we are playing an increasingly supportive and consultative role where we're highlighting the resources to help schools assess and track their adherence to the mitigation measures, really to help support their success and in safe environments.
Thank you.
Thank you.
Any other questions of Karen before we move on to the agenda? Okay, seeing none, hearing none. Thank you, Karen. We appreciate that and your continued advocacy on our behalf. Moving on to item 5 on the agenda, approval of the minutes. I will entertain a motion to approve the minutes of February 11th, 2021.
So moved, Weeks.
Motion by Dr. Weeks, seconded by Dr. Wilson. Are there any additions, corrections, or deletions to the minutes as presented? Hearing none, seeing none. Since we do not have a quorum in person, all of our votes are roll call. Penny, would you please call the roll?
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye,
Mr. President, the motion passes.
thank you, and the minutes are approved. Moving on to the treasurer's report. Mike, would you take it from here, please?
Thank you, Mr. President. As of January 1st, the Health Department General Fund balance totaled $30,311,588.80. Receipts for the month totaled $2,235,295.02, and disbursements totaled $5,582,080.72, leaving a month-end total in the Health Department General Fund of $26,964,803.10. Combined balances in all 4 health department funds as of January 1 totaled $37,440,484.09. Combined receipts for the month totaled $2,267,041.61, and combined disbursements totaled $6,001,562.47, leaving the combined balances in all 4 health department funds at $35,302,724.11. Investment earnings recorded to the general ledger in the month of January for all 4 health department funds totaled $4,129.28. Including these earnings, the year-to-date combined investment earnings as of January 31st totaled $8,276.15. That concludes the report. Are there any questions?
Thank you. I'll entertain a motion to approve the treasurer's report. Someone?
So
Anyone?
moved, Weeks.
Motion by Dr. Weeks. Is there a second?
Second, Wilson.
Second by Dr. Wilson. Any questions, comments regarding the treasurer's report? Hearing none, seeing none. Roll call, please, Penny.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Penny, we're having a hard time hearing you. At least I am.
Ms. Bottoms,
There we go.
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye.
Mr. President, the motion passes.
Thank you. And the treasurer's report is approved. Moving on to consent, I will entertain a motion to approve the consent item under personnel transactions as laid out in your packet.
So moved, Wilson.
Motion by Dr. Wilson. Is there a second?
Second by Garcia.
Second by Member Garcia. Any questions, comments? Hearing none, seeing none, roll call, please, Penny.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Guider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Skelton,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. Moving on to item 8.1. This is the proposed Board of Health bylaw amendment on public comment. In your packet, you've all received what we would generically call the bylaws, or they're called the rules of governance, and there have been some changes in numbers, but those have been necessitated by the public comment addition to the bylaws, which had never been addressed in the bylaws or rule of governance. And after some of our public comment issues, we thought that it was probably time to talk about it. So before we get into discussion, I will entertain a motion to approve the bylaw amendment as set forth, section 9, the public comment and rules of governance.
Wilson,
moved.
so second.
Motion by Mr. Spadoni, seconded by Dr. Wilson. And for just before we get into any other purposes of discussion, as you can see, the public comment, as I indicated earlier, we had some discussion on this as a board over a couple of meetings. It mirrors essentially the language in the county board rules. You can submit notifications by electronic means. The remarks are confined to topics or activities which are within the statutory authority of the Board of Health. Individual remarks shall not exceed 3 minutes of length, nor 30 minutes in their entirety unless special permission for an extension is granted by the board chairman, but that would be the board. You can certainly submit things in advance. And submissions in written should not exceed 500 words, which according to Lisa was about a 3 minute, about 3 minutes. So that's essentially what I think we all discussed. We all had a consensus agreement on. Does anybody have any comments or questions regarding the proposed bylaw amendment? Hearing none.
I have
Yes,
a
Mindy,
quick
yes.
question. So I know this might be silly, but is Board of Health chairman, is that all of us? Is that the president? Who is that referring to? Is
You
it a
know,
general thing?
I just looked at that now, and I don't know if Lisa, your intent was to give that power to me, but I would certainly suggest that be to extend the length be something that the entire board should agree to. Can we
That's fine.
amend that on its face now?
That's how we can amend that.
Okay, so basically granted by the board, so we could just strike the word chairman.
So it
That's
would be
fine.
on point 1 and point 3. Number 3 has it in there too. It says therefore by the board chairman, so it would just be by the board.
Well, it
Well, I
depends.
think the notification just is simply to the board chairman, but I'm fine with taking.
I think
chairman
it just
out of
only
that,
3
so,
would need to be corrected, really.
Yeah, I mean, I don't need any more notifications by anybody, so if someone wants to take it on, but I guess it's just because the board chairman or board president would be the one dealing with the agenda. I presume that the notification would go to him or her, whoever that might be. So that's right, Lisa, is that my?
And that's just going to be the form that's actually at the
Right.
meeting that they're,
Right. But I do think that on number 3, we can strike the word chairman so that it's not a unilateral decision to go beyond 30 minutes. Is everybody good
That-
with that?
that's fine if that's what the board would like.
Everybody okay with that?
Yes.
Okay, so do we need another motion as amended then, or can we just?
Another motion to
Okay,
amend.
is there a motion to amend the motion on the public comment to then strike the word chairman from item number 3?
So moved.
The motion by Dr. Stoughton, seconded by Mr. Spadoni. Okay, so we have an amendment to the motion to strike board chairman. We have there's a motion and a second. We have a roll call on that, please, Penny.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir.
Yes.
Mr. President, the amendment passes.
Okay, now that we've amended the motion, we have a motion and a second to add section 9, public comment as amended. As a motion and a second, any further discussion on the motion regarding the amendment? Hearing none, seeing none, roll call, please.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten.
Yes.
Mr. President, the motion passes.
Thank you, and the motion carries. And thank you again to Lisa, to Karen, Penny for putting this together and putting it in a form that makes some sense to us and hopefully will now be implemented in our rules of governance or bylaws. Moving on to item 8.2, grant acceptance. I'll entertain a motion to approve item 8.2A, the Illinois Department of Public Health mass vaccination grant.
So moved. Weeks.
Motion by Dr. Weeks,
Second, Garcia.
second by member Garcia. Any questions? Karen, you want to just real quickly tell us about this one? If you would, please.
Sure. This is a $2.5 million grant that we were offered by the Illinois Department of Public Health to operate our local vaccine efforts. The extent of this grant, although 2.5 million is a significant amount, I don't mean to imply otherwise. It still only covers the very direct costs of operating our site at the fairgrounds. So that, some of the other operations, like being able to provide some sort of incentive for our partners to be doing vaccine, or our off-site clinics or things like that are not covered. But the vast majority of the costs will be supported through this grant.
And if I can add a little bit, Karen, would you tell us what the total amount of the grant was to the state?
Sure. So the total funding, this
Funding.
yeah, the funding emanated from the federal government in their action that was on December 27th of 2020. The state of Illinois received $90 million for mass vaccination efforts. I think, Adam, do I remember that the state offered local health departments, which are really the crux of the mass vaccination work being done. The state provided grants in the total amount of about $27 million and kept the remainder of the funding at the state level.
They did go slightly higher than that. Like they went to like 32 million, I think.
Okay. So yeah, so local health departments received about a third of that funding, and the other 2/3 was retained at the state level.
And again, if we were to use simple math, the state of Illinois gets $90 million for mass vaccinations, and we have 7% of the population, then $6.3 million should go to the DuPage County Health Department, and we got 2.5 million. Also, that 2.5 million is for mass vaccinations, for which that's not our plan. That's not, we don't have one or two locations like some other counties do. We've dispersed the vaccinations through well over 100 partners to be able to get it into as many different arms as possible. Yet, correct me if I'm wrong, Karen, because I don't want to editorialize, although it seems like I am, that we're being punished because we don't have one mega site to be able to get this money, and because we have more partners than we have vaccines to be able to spread it out as best as possible, we can't use this money to our partners who have invested significant resources in getting their vaccination sites up and running. Am I on
That's
board?
correct.
Okay.
That's correct.
Sorry about the editorial. I just want everybody to know part of the problem and part of what we're going through here is this disconnect between the state of Illinois and local health departments. It's not a fiction of somebody's imagination here. So, but in any event, we appreciate the $2.5 million. I think we have a motion and a second. Do we not, Penny?
Yes.
Okay. Any other discussion, comments regarding this? Okay, hearing none, seeing none. Roll call, please.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein, Dr. Hussein,
Yes.
Dr. Minier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatori.
Aye.
Mr. President, the motion passes.
And the motion carries. Moving on to item 3, if there's no objection and no one wants to pull any of these items and vote on it separately, I'll entertain a motion to combine items 3A through P under purchasing.
So moved to combine and approve.
Motion to combine by Dr. Wilson. Is there a second?
Second.
Second, Guider.
Second by Member Geider. Any discussion on the motion to combine? Hearing and seeing none, roll call on the motion to combine only, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Minier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatori,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. And the items are combined. I'll entertain a motion to approve the items as combined, please.
So moved.
Motion by
Second,
Dr.
Garcia.
Wilson,
Second, Garcia.
second by Member Garcia. Any questions on motion? Roll call, please, Penny, to approve.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Minier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatori,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. And the items are approved as combined. Moving on to item 9, any unfinished business. Does any member of the board have any unfinished business to bring before the board?
Quick question for you, Chairman Tornatori. I know Karen had brought up about maybe sending a letter from the Board of Health to the IDPH or someone to try to get some clarity on what's going on. And I think that would be a good idea to do sooner than later. I don't know if I can get a letter written, we can sign off
yeah.
or how that would work.
Well, Karen, I'll let you answer. I think this is me, the elected official, as well as a board member here, wearing a couple of hats. I think it's potentially problematic for our health department executive director to be sending, I don't know, Karen, I don't want to speak for you, but Karen's got to deal with IDPH in the governor's office every day. So I don't know that it's best for the health department to be raising some of these issues. I think that these issues.
I'm more like as the board here, the board that's here sending a letter.
Well,
We want them to.
yeah, but the board is the health department. So I mean, I guess that's my concern. I certainly have no objection to it, but I think that perhaps that's more a county board. It would have more juice to it, if you will, if it came from the county board elected officials representing the public. It also then keeps the health department out of the fray, if you will, between the governor's office and
Totally understand. Don't want to
Dan Cronin or anybody else. So I'm Karen. I don't know if you think you ought to send a letter, I'll sign it with you. But I kind of like to keep us out of the crosshairs between.
I feel like I'm catching enough arrows with what I'm doing. So yes, I would appreciate that.
I think we got to protect Karen and Chris and Adam and Andrea and everybody else from what's happening. So, but I think that's something we need to take up at the county board level, certainly. Any other unfinished business?
Okay, Karen is going to deliver a message in Pig Latin, right, Karen?
I am going to have to really consider that for a while, though. I'm a little rusty.
I think they know how Karen feels already, but we're gonna, as we all do. Okay, nothing further under unfinished business. Any new business before the board? Anybody have any new business they wish to bring before the board? I'm looking around. I see no, hear nothing. Okay, moving on to the next meeting of April 8th. And God willing, some of us, at least if not all of us, will be in the room together. And if we are, the pizza's on me. So we'll hopefully get a chance to see each other again, which has been way too long. We have nothing under executive session. Is that correct, Penny?
That's correct.
We have no executive session, so I will move on to item 13 and entertain a motion to adjourn.
So moved.
The motion by Dr. Wilson. Is there a second?
Second. Weeks.
Second by Dr. Weeks. No discussion on that one. A roll call, please.
Dr. Wilson?
Yes.
Ms. Bottoms?
Yes.
Ms. Finch?
Yep.
Ms. Garcia?
Yes.
Ms. Geider?
Aye.
Dr. Hussein?
Yes.
Dr. Manier?
Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatore?
Aye.
Mr. President, the motion passes.
And we are adjourned. Thank you all very much. Stay well, stay healthy. We will see you on April 8th in person.
Thank you.
Bye.
Bye-bye.
Thank you.
See you, everyone.
Welcome, Paula.
Welcome, Paul.
Yes.
Take care, everyone.
Take care.